Welcome to this unit on liability for AI in clinical care. By the end of this unit, you will be able to discuss issues of liability in the use of AI in clinical decision-making. Liability for the use of AI in clinical care. Using AI to support or augment clinical decision-making raises questions of liability for both healthcare workers and hospitals. For example, should clinicians be considered at fault if they follow the suggestion of an AI technology that results in a medical error, ignore an AI suggestion that would have avoided morbidity or mortality? Answers to these questions depend on choices. Choices include the types of behavior encouraged or discouraged by a legal system, and the standard of care as the use of AI in clinical practice becomes more common. Another choice is whether liability rules should encourage clinicians to rely upon AI to inform and confirm their clinical judgment, or to deviate from their own judgment if an algorithm arrives at an unexpected conclusion. If liability rules penalize healthcare providers for relying on the conclusions of an AI technology that proves to be incorrect, they may only use the technology to confirm their own judgment. While this may shield them from liability, it will discourage the use of AI to its full potential, which is to augment and not just validate human judgment. If clinicians are not penalized for relying on an AI technology, even if its suggestion differs from their own clinical judgment, they might be encouraged to make wider use of these technologies to improve patient care, or at least consider using AI to challenge their own assumptions and conclusions. Whether a clinician uses AI also depends on the prevailing standard of care. If AI technologies are considered to deviate from the standard of care, clinicians will be discouraged from using them. However, if the standard of care requires the use of AI technologies, they would essentially be mandated to integrate their use into clinical practice. Another issue is the liability of hospitals and healthcare systems that select a specific technology. Hospitals could be held liable for failure to exercise due care in selecting, using, or maintaining the technology, and a hospital could be held liable for errors made by clinicians who work at the hospital. Hospitals are therefore encouraged to exercise due care in selecting AI technologies and ensure clinicians have clear guidance on how to use technologies for both patient care and to avoid errors that result in legal liability for the clinician and the hospital. Hospital liability could be established by negligent credentialing. Negligent credentialing is where a hospital can be deemed liable for harm caused to a patient if the hospital failed to adequately review the credentials and practice history of health workers. The theory of negligent credentialing could be applied to the hospital's duty to assess the appropriateness of an AI technology before it is introduced for use. For this to apply, hospitals and health systems need to have the necessary information and tools to identify appropriate AI technologies for clinical use. Hospitals should also have a duty to re-establish control of a process or system that has been automated, but now presents actual or potential risks that were not previously foreseen. You have now completed Unit 1 of Module 6, Liability Regimes for AI for Health. In the next unit, we will look at AI product liability.